Thank you for joining us. Today I have Dr. John Crues, who's with Radnet, and today we're going to talk about musculoskeletal imaging. Welcome, thank you for joining us.
Oh, thank you very much, Lisa. Thanks for inviting me.
So musculoskeletal imaging, what is that?
That's imaging of the bones, which is the skeletal part, as well as the muscles and the tendons associated with the muscles throughout the body.
And is it specific to one area of the body, or you can do it the entire body?
And it's really the entire body.
Okay.
So it's basically any part of the body that's involved with the skeleton or anything that moves the skeleton.
Is it just one part of the body, or is it the entire body?
No, it's really the entire body. It's all of the bones and anything associated with the bones that moves the bones.
Okay. And then what type of equipment is used for this kind of imaging?
Well, traditionally, X-rays were used extensively in looking at the bones and the joints which are associated with the bones. But what we found out more recently is that the ultrasound is very good for the soft tissues, but it's not great for the bones. CT came along a couple of decades ago. It gives us much higher resolution, but it basically gives us similar information to X-rays because it uses X-rays.
Mm-hmm.
But the real breakthrough in musculoskeletal imaging occurred about 15 to 20 years ago, when MRI started being used to look at the musculoskeletal system, and that's really our mainstay right now for evaluating the musculoskeletal system.
So someone would not have to have an X-ray first and then an MRI, or do you just go straight to the MRI?
It depends upon the information you're after. Many people will get X-rays first. A lot of physicians are familiar with looking at the X-rays themselves, so they like them. Some insurance companies think they might be able to delay getting an MR scan by getting X-rays first. But X-rays really don't give us the kind of information that an MR gives us. So what we want to know has to do with the joints and the insides of the joints, what's called internal derangement, then X-rays really don't help very much there, and it's best just to go straight to an MRI and not waste the money on other technologies that won't give us the right answer.
So for instance, if someone was to break their leg, you could easily see that in an X-ray, but what else would you be searching for with the MRI?
Yeah. If you're looking at a standard broken leg, you don't need an MR scan, because you can see the break in the bone very nicely with X-rays. The issue, however, is that there are many injuries of the bone which are not severe enough to actually produce a break that can be seen on an X-ray, but still cause pain. We call them trabecular bone injuries. They're actually much more common than a regular fracture. And those you can't see by X-ray. And if there's a concern about why the person is having ongoing pain, then an MR scan may be helpful in that setting.
Okay, great. And then what advances are you seeing in this field?
Of MRI?
Yes.
Well, 20 years ago, people said that MRI could not be used for the musculoskeletal system because it couldn't see bone very well, and we've come a long way since then. Right now, there are many different ways to do an MR. It's not like an X-ray where you shoot an X-ray beam through the body and you detect it on the other side. There are literally thousands of ways to do different MR scans. And there's still a lot of research being done as to what techniques are best in different clinical settings. That's still a very active area of investigation.
Okay.
Currently, they're using very sophisticated techniques to actually image nerves and to see if the nerves are functioning properly. And it looks like that's going to be a much better technique than what we used to use, which were EMGs, which are not very sophisticated instruments to look at nerve function. So that's one of the most recent hot topics in investigation of MRI in the musculoskeletal system.
Would it be conducted in the same manner that an MRI is today?
It's conducted in the same manner as far as the patient is concerned.
Okay.
They lie in the scanner, they're positioned in the scanner. The way the actual data is acquired from them is, though, much more sophisticated. It allows us to actually see directional flow of the molecules inside of a nerve, which is what's required for functioning.
Okay.
And we could not do that in the past.
That's amazing. What do you see coming down the pike?
Another area that's an active research, and I think there's going to be a lot more on this in the future, is to understand what injuries of the musculoskeletal system are really important and cause pain and what don't. For a long time, we thought that meniscal tears all needed to be operated on. We now know that most meniscal tears aren't, and MRIs helped us understand which tears need surgery and which don't. So I think coming down the pike, we'll become much more sophisticated at directing what kind of treatment occurs, not just making a diagnosis.
Sounds a lot like precision medicine.
I think that it's right along the line of precision medicine.
Yeah.
Usually when people talk about precision medicine, they're talking about basically genetics and DNA. But there's a lot that we can do in MR in the musculoskeletal system that can tailor individual studies to individuals and determine the appropriate way to manage them.
Sounds excellent. Well, thank you so much for the information.
Certainly.
And remember, if you would like more information about what we just discussed, you can go to radnet.com.